hope lecture is are online now, providing such educational lessons. Online, only for educational purposes. If anyone wants to comment, that's okay, we will interact with comments. But most of the time, will be focused on the lecture. Only dentistry for this season. We'll be studying dentistry for about 2 years till we finish lecture for today, which is called fibroosseous lesion. We'll start talking about fibroosseous lesions, and anyone interact with this lecture as they wish. I will answer questions as far as we can understand the lecture of the fibroosseous lesion. For about an hour, this will be the live stream for today. Fibroosseous lesions are a group of conditions characterized by placement of non-global fibrosis trauma with varying amount of open bones. You can read it as it's presented on the screen. Well, I will read it also silently. Maybe I will speak just so that people can understand where am I in this lecture. This lecture is talking about the fibroosseous lesions. Very important lecture indeed. I will type this on the chat. Very important. Lecture. And everyone take part of this lecture as we will represent it, and we will talk about this lecture right away. About talking about fibrosis lesions, very known and important subject that is widely being talked about in the dental field. Fibrosis conditions are characterized by fibrous trauma with a varying amount of wound spicules and cement-like materials. This one We all know a very important subject, as the cementum-like materials are present now. The bone is being replaced by the stroma or the fibrous stroma, because of the histology similarities between these diseases. Proper diagnosis requires a correlation of history and clinical and radical findings. The radiographer findings being the most important to understand such lecture. I hope you all this lecture and seeing what I'm talking about this important part of the lecture within this live stream of today's lecture. Fibrosis lesions, a group of conditions characterized by replacement notable by severe fibrous stroma. As the subject for today is fibrosis lesions. Replacements, just a replacement of, let's see, it's a change of action in bones, as bones are being presented primarily. Go ahead and present this. Stroma replacing the normal bone. It is called a fibrous stroma within its varying amount of woven bone. Facing this amount. And there is a historical similarities between these diseases. Proper diagnosis requires correlation of history and clinical findings. That's why fibrosis or the fibrous dysplasia that will show in the next picture or the next slide. The one of our most important slides is this lecture. The commonly included the following: rare diseases, proper diagnosis requires for correlation of clinical findings, or proper diagnosis, as they are very similar. History where radiography. Fibrosis lesions, including the fibrous dysplasia, that we will talk about in the next slide. Fibrosis dysplasia, whether it's a focal, peripheral, and the right, and the ossifying fibroma. Ossifying fibroma. One lecture or slide that we haven't used yet. A report slide. We already studied the fibrous asymmetrosis. Beginning with the fibrous lesion. This is a normal condition. Replacing normal by severe fibrous condition. Mixed with a regular bone cervical. Mixed based being very well known in the dental field. It represents development of the tumor-like condition. As the name suggests, facing the normal bone, we will have fibrous connective tissue. X variable. Its replacement is regular formula. This replacement by fibrous connective tissue makes the regular formula. Next, we'll be talking about the causes of this mutation. Causes of this mutation are well known. These causes can produce various types of injuries. Number 3, mutation in the gene, protein G encoding protein. The gene encoding or G protein. Mutation in the gene encoding of protein. Again, I repeat, caused hyperdysplasia by the mutation in the gene coding G protein. Clinically, fibrous dysplasia may manifest as monostotic, polystotic, and Albright syndrome, all being very important. And for this subject, it will take about an hour to finish. Albright syndrome is a polystotic type. It is in association with endocrine hormone and pigmented skin makeup. Endocrinolosis, pigmented skin, starting with monostotic fibrous. As the name suggests, only one bone is being affected by this dysplasia. And the monostotic dysplasia, clinically and radiographically, is very important, represented here. The monostotic, there is monostotic, polystotic fibrous dysplasia. And we begin with monostotic. The monostotic fibrous dysplasia, unlike the polystotic or Albright syndrome, as the Albright syndrome we already discussed, causing a macule pigmentation, also is polystotic, that caused while there is endocrine dysplasia or endocrine abnormality. Clinically and radiographically, monostotic fibrous dysplasia limited to a single bone, 80 to 85% of all cases. Hope you understand this very well, subjects, as this subject is very important in the future. Will help us understand this subject, and you can focus very well on such subject. Monostotic fibrous dysplasia, clinically and radiographically limited to a single bone, 80 to 85% all cases. Patients between 20 and 30 years of age, males and females, are equally. A little bit the younger or the adult are affected with monostotic dysplasia, which is a type of fibroid dysplasia. And the males and females are equally affected by this disease. Let's go next to second slide. You might see portraits, potential being presented itself. This subject, as an overview, will give you for this lecture. As you can see, very poor subject for today's lecture. Not very well. Not everyone can see this lecture very well. That's why a change of visuality is necessary. This lecture in dentistry is very important for everyone to understand, as this lecture will affect everyone's life, some point of his life. Let's go ahead and present you all the slides of this lecture. We have this slide, for example. Many slides we have today. Let's go ahead and change the visuals for a little bit. And we can see here visuals are much easier to understand this section. For this lecture, these visuals are being presented to you just right away. This is the visuals that we are presenting to you. Please make sure to understand such visuals. That will help you in your normal life. This lecture is very necessary for your understanding. We'll take a bit of the lecture to understand it. There is some writing here we have represented with other green, but I don't know anyone can take good attention to it. That's why we will try to freeze the exercise. Fill the screen. And also reduce the size a little for the lecture to be presented quite normally. This lecture is for today. Very important. Sorry for making you wait all this time. And let's go back to see what is this lecture about. We read here the fibrous dysplasia, the monostatic fibrous dysplasia, many important subjects to be discussed by the section. This lecture is very necessary, of course, for the entire world to make a good judgment on whether this lecture is important in his life or not. Let's go ahead and show you this lecture very clearly. doing the fibrous dysplasia and what is the fibrous dysplasia. Hope my voice is well. You can understand it very well. On the structure. Yes, my voice is very well. That's why we will finish this lecture right away. Monostotic fibrous dysplasia. And what is the monostotic fibrous dysplasia? Clinically and radiographically, we will make sure to understand such lecture quite well. First, we talked about the fibrous dysplasia in general. Fibrosis lesions, just a type of fibrosis lesions. What we talked about later, at the beginning of this lecture. But now we will finish talking about in deep how the fibrosis dysplasia can affect the bones. At the beginning, we talked about the fibrosis lesions, and they were divided into fibrosis dysplasia and cementosis dysplasia, which were divided into focal, periapical, and fluoride dysplasia. Also, fibroma is a type of fibrosis lesions. As we saw here, was the effect of the G protein of fibrous dysplasia, gene encoding fibroma, dying, focal, periapical, and of course, last but not least, one with the focal, the fluoride. These were the fibrosis dysplasia, cementosis dysplasia, and also ossifying fibroma, all parts of fibrosis lesions. Starting with fibrosis. Hopefully is a very important lecture. Be interesting. Please read with us silently. Albright syndrome, type of polystotic fibrous dysplasia, that is a mutation of G protein, placement of bone by fibrous trauma, connective tissue around bone trabecule, irregular, resembling a tumor-like lesion. When it comes to the Albright syndrome, polystotic dysplasia, and Albright syndrome, we focus very well. We all know that is a change in color, causing macules, pigment lesion of the skin, associated with, of course, the endocrine abnormalities. Some people call anomalies. Just another type of describing this virus. Go ahead and finish. Oh, sorry. Monostory affecting the males, females. The maxillary arch, causing fibrous connective tissue, irregular bony trabecule. Instead of those is bone. Affecting one bone, female and male at equal ratio, 50% to 50 to 80%, 5% produced of all cases. Symptomatic, ground-like dysplasia, lesion, groundless radipic. Well-defined borders. Resembling developmental lesion. Painless. Patient says are adults, 20 and 30 years old. I hope everyone knows first paragraph of it. And let's move on to the next part. Mono dysplasia affecting the maxillary area, as we can see here. There is an effect on the maxillary area, causing a small swelling, peak. Same goes for here. Swelling in the maxillary area. Hope you understand very well. Until we have swelling to the maxillary area. Monostotic fibrous dysplasia swelling affecting the maxillary area. Here we have the same thing. The ground has or groundless. Radiopacity, the monostotic, fibrous dysplasia. Ground glass radiopacity is a well-known feature of this radiographic appearance. A distinctive feature of the monostotic fibrous moving on to the polyostotic fibrous dysplasia. Polio, sometimes scientists use the word polio. Sometimes they do use the word polyostotic. But polyostotic fibrous dysplasia is better pronunciation of the disease. At first, it's affecting 25% of the human ratio of all cases to 20%. Number two, I'll say that the polyostotic fibrous dysplasia affected many women, resembling developmental granuloma type of fibrous lesion. This one affecting the females more than males, causing pain, deformity of the bone, unfortunately. And we'll see some pictures showing these deformities. Some patients, please be advised, as we will show a very graphic image in the next slides of this lecture. Again, I will repeat, be advised. Affecting the mandibular interior, exactly the mandibular posterior side of the arch is more affected than the mandibular anterior. Young patients less than 20 years of old are mostly affected by this lesion. Unlike the monostotic fibrous dysplasia, females and males are equally affected. Just like a monostotic fibrous dysplasia affecting males and females at equal ratio. Only the age is different. And there is no mention. Be advised, as graphic images will be shown briefly for those who are watching. Okay. Understood. But polystotic fibrous dysplasia affecting me is the same as monostotic. Comes to females and males. Only the age different. Percentage. Multiple bones like ribs, cranium, fascia, vertebral, rock bones and limb. Pain, and we talked unlike monostotic fibrous pain and deformity of the bone. Please read this slide. I would say like, please read this slide. I don't know if it's first words, the first few sentence of my, I don't know, my word is being cut, cut. It is a little hard to explain that a few words of my sentence is being cut because of the program called OBS. But now we finish all the lecture. Moving on to see all the images that we will present to you, and this image will be a graphical in nature, so be advised that these pictures are not suitable for everyone to watch. Polystatic fibrous dysplasia. The next type of polystotic fibrous dysplasia is called Albright syndrome. Albright syndrome is a polystotic fibrous dysplasia affecting multiple bones, affecting females more than males. This type of inflammation or infection is a fibrous or can be described as fibrous lesion or a fibro-osseous lesion. Only 5% of cases are presented with Albright syndrome. As this kind of inflammation or granular can not only affect the vertebral or the craniofacial and the cranial and the ribs and the long bones, but it is also causing a pain, and it is followed or adjacent to the disease of the endocrine abnormalities. With a very distinctive histological representation of the low T or Chinese letters being presented on the histogram. Calf ovate shape or color discoloration of the skin. And this one is more common in females, unlike the polystotic and the monostotic fibrous dysplasia that is common between females and males equally. Again, females and males equally. Albright syndrome is more common in females than in males, caused polystotic lesion, which is causing pain, followed with endocrine or accompanied by the endocrine big anomalies. So it is not only skin pigmentation but also polystotic type of lesion. Hope not that I am wasting anybody's time, but I wish that my lectures are important for everyone to understand that these lectures are made for you and for everyone else. Uh, this lecture will provide you with the basic knowledge. Also, if you don't want to contribute such lecture, you can leave a like or comment, and I will respond briefly to this information if I do have such knowledge, or else if I don't, then I will answer with the typical knowledge of saying that I don't know what is the answer. I don't think that this slide is important for us to discuss. And that's why we will go to the next slides. As we can see in this lecture, fibrous displays bone trabeculae forming irregular structures resembling Chinese letters. The caveolate structure-like pigmentation on the skin resembling with this lesion, and also a polystotic lesion. And that's why this type of lectures are important for everyone to understand. Take good notice. And now, after we talked about the polystotic, monostotic, Albright syndrome, polystotic dysplasia, and we knew the difference between them, that the polystotic from the monostotic, the females and the males are same in ratio, and they are affecting both the males and females at the same time. But only the last one, that's called the Albright syndrome, affecting females more than males. And the maxillary arch being affected with the monostotic fibrous dysplasia. We also know about the percentage of all from 25, 20, 85, 80% to 5%. All these percentages representing the types or each type of the disease. Of course, we don't have to go back and review such important information for the second or third time. That's why we will move on talking about the treatment and prognosis of the fibrous dysplasia. Then later we'll talk about cemento-osseous the cemento-osseous dysplasia, focal and fluoride. Now he is talking about the poly. Now he is talking about the polystotic dysplasia. The first is that one, the polystotic, the monostotic, the Albright syndrome, all do not need any type of medication or treatment, although the polystotic dysplasia causes pain and disformation before causing deformity of the bone. At the, talking about the first stage, if it is a small part lesion, then there is no need for adjustment, no need for treatment. Here we can see when it is large or giant size, large size lesion, a, treatment is required, what we call it a contouring treatment, or there is when only pain and deformity of the bone is being presented. We use a surgical recontouring. If there is or when there is fiber dysplasia affecting the cosmetic or the function of the mouth. Very well indeed. Very well indeed. And because these fibers dysplasia being presented to us, because they are important, we are talking. I repeat, because these fibers are important, we will be talking about briefly and not continuously. And this is why this subject is important. Surgical treatment, decontour, causes of cosmetic or functional deformity may be treated. Malignant is a rare complication. The sound is now better and everyone can understand what are you talking. The treatment plan for such polymonostotic is not such an important subject. That's why we will not focus on such. Moving on now to the next slide. Please, before that you are watching such lecture with a very good focus on your eye and on your mind, as such lectures are not easy to understand, need a good effort of understanding, a good effort of realizing such polymonoalbright syndrome lesions, fibrosis lesions, cemental osseous lesions. The cemental osseous dysplasia is the most common fiber osseous lesion. Please, you read such lecture such slide with me silently. I don't want to talk too much. Read it, and I will briefly and shortly give a subtract to this. Unlike the fibrous dysplasia, the cemento osseous dysplasia has the unknown reason of its initiation, while the first having G protein encoding problem. This one occurs at the tooth-bearing area, while the first one, the fibrous, occurs at bones, the bolus or polyostotic, and one or affecting females are the Albrightson. One is affected dirty, called the monostotic. Mental osseous dysplasia is developed focal mental and also periapically osseous. Last but not least, the fluorescemental. Such cemento-osseous dysplasia with the focal affecting females 90% more than being the one, just like the fibrosis dysplasia occurring with the Albright syndrome. Posterior mandible being the most affected side. And I don't know if the patient is young or adult, but we used to say that the maxillary is affected with monostotic fibrous dysplasia. Now it's fibrous. Causing no pain, unlike the polyostotic. that's a good thing that the disease has no symptoms, while in polio causes pain. I am comparing this lesion with the previous lesions that we have discussed: fibrous dysplasia, polyomono, and Albright. Now we talk cemento. Now we talk about the cementosseous dysplasia, and I'm comparing it to others. Meaning with the focal, female are more affecting the anterior mandible. Posterior. Less than 1.5 centimeters and painless. Unlike the one we discussed before, the one that's having pain, which distinctive feature causing pain. While this one is painless. And I am thinking when I put like my hand on my head, I am thinking of others, comparing them together. Let's take a rest for a second or two, and I will be back shortly after. Uh, we will take a rest just right now, so please take a rest. Take rest, as the rest is important thing to do this time. And we'll start talking briefly after rest finished, because this rest will help us respond lecture. Hope you are hearing me. As we will continue this lecture, briefly, and we will have a very amazing day discussing such important lecture. And ooh, we are doing some filtration with the noise gate, isn't it? And there are noise. Sorry about this. It's only part of some things I'm doing well to make the sound quality. And now we are very ready for you and for everybody. Hope you can hear us very well, as even I whisper, you can hear my voice. Although there are some noise in the background. Please wait for us while we figure this out, while we are taking this rest. Please wait while we figure while we are taking this rest. And now it is clear. closing the threshold. I hope. So loud. Um, and now the threshold. This is better for now. This is a question. I hope it is better. And there is a suppression of the voice. That will not include the voice before it. 1, 2, 3, 1, 2, 3, 4, 5, 6, 7, 4, 5, 6, 7. Everything is cool then. Let's start the lecture again. Okay, we'll complete the lecture then. Focal cementoosseous dysplasia. A very important subject to be studying. Everyone in the world must study it. let's go ahead and start discussing the focal cementosus dysplasia, radiolucent area in early lesion. After we made sure that the threshold of the voice is very clear and everyone can hear it. Next few things might be going to the voice settings, troubleshooting, and all these are important, of course. Microphone with the advanced settings. All are important in the case of our discussion right now. Fortunately, the voice is not very close to the source. If it's here, then the voice will be better, I guess. And if I am shouting, then the voice would also be better. Close. If it's here, then the voice will be better, I guess. And if I am shouting, also close. Hopefully it is now clear to hear. Hopefully it is now clear to hear. And yes, I am sure it is. And if we want to make a call online, then we'll try to increase the voice for everyone to hear it properly. Now we finish this important phase. Read its silence. And of course, this one is all about the cemento osseous dysplasia, focal. And focal, especially, is taking to around paying good attention on the posterior teeth, because they are the most important teeth that are present in the mouth. Peripheral being the anterior, as we'll discuss later. This was the focal, then peripheral. I mean the apical, or present with female with the mandibular jaw. And I'm happy that this kind of things are present, all of which in such lecture. Many people find it interesting to hear such an important lecture. Let's go ahead and study this one silently. This one is the same as the previous one, cementoosseous dysplasia. Not the periapical one, the periapical. Females. These, the previous one was with females. With the age group of more than 30. Black females also the same, anterior, mandibular. Cementoosseous dysplasia of your right. Cementoosseous dysplasia of periapical. And the cementoosseous dysplasia of not the polyostotic one. Albright syndrome, no. Cementoosseous dysplasia. Not the fluoride. Not the periapical. Let's review the slide. Focal. Which name was focal? And it was in the mandible posterior. This one is the mandible anterior. Females. Okay, symptomatic. And also with females with age group 20 to 50. The previous one, the focal, was 20 to 30. Polyostotic was with, or Albright was with, let's see. Albright syndrome was with female. A monostotic adult, polyostotic with young, Albright syndrome. I don't know, we have to pay that much attention of females, males, which one causing at where, and it's really too much information that we do not need. That's why I'll be focusing on the focal being at the mandibular posterior area. Again, cementosis dysplasia, focal, focusing on the posterior mandible region. Or the periapical one, or the anterior region. All the traumatic condition, was vital. More about cementosis dysplasia focal. As the early stage of this lesion, a puerile circumscribed area of radiolucence mature over time to create mixed radiolucent and radiopaque appearance. And the stage of circumscribed dense classification surrounded by non-radiolucent rim. Last type of cementosis dysplasia is the fibrosis or fluoride cementosis dysplasia. Again, fluoride cementosis dysplasia. Oh, here's the multifocal involvement. This one is not limited to anterior or posterior mandible. Not like the focal that was on the posterior and the periapical was on the anterior. This one is on the anterior, posterior, middle-aged black woman. Said I will not focus on such distinctive features of age and sexual orientation. This female black female, this previous one was dealing with also females, if we remember, also black females. Cementosis dysplasia. Also with females, 90%. All happens with females. Any cementosis dysplasia will happen with females. Albright syndrome associated with endocrine anomalies are also associated with females. Largely radiopaque with only a thin periodic radio central. Same as the previous periapical lesion that was at the beginning radiolucent and gradually becoming more radiopaque. I have an idea. How about we play a game after we finish cementosis dysplasia histopathology, treatment and prognosis of cementosis dysplasia and ossifying fibroma. Ossifying fibroma, second slide. Histopathology features of ossifying fibroma, treatment and prognosis of ossifying fibroma. Juvenile, aggressive ossifying fibroma. Clinical radiograph regions, histopathology of ossifying fibroma, treatment of cause of juvenile ossifying fibroma. We will not go to the ossifying fibroma, but we'll talk about cementosis lesion histopathology. After we talked about radiography, fluoride, cementosis fibroma, cementosis fluoride cementosis dysplasia. We talked today about many things actually. First, fibrosis dysplasia. In general, fibrosis lesions. First, fibrosis dysplasia. We talked about monostotic fibrous dysplasia, polyostotic fibrous dysplasia, Albright syndrome, fibrous dysplasia, cementosis dysplasia, focal cementosis dysplasia, periapical cementosis dysplasia, fluoride cementosis dysplasia, and ossifying fibroma. Let's go ahead and show you the ossifying fibroma here. First, let's talk about the histopathological features of cementosis, fluoride cementosis dysplasia. I have an idea. How about after we finish this lecture, we'll talk with people on the internet, or we'll do Omegle, or we will do some kind of Slither IO. But let's finish first. Very powerful tool, micrograph showing specimen. Hard tissue, moderate ciliavirus connective tissue, etc. Treatment and prognosis of symptomatic dysplasia. As they are not neoplastic, do not form cancer, that's why they do not need removal. Resourcifying fibroma. With mandible more than any other structure, just like the cementosis dysplasia, not like the fluoride or type or portion or type. Or more slow growing lesions, well circumscribed, defying fibroma is a neoplastic lesion, of course. Area mandibles, 12 regions. And these are all types of treatments. By surgical removal, the lesion can typically separated. Recurrent is rare. Juvenile. Variant of ossifying fibroma. Trabecula and some more matoid ossifying fibroma. Trabecula 11, pseudomastoid 22, that age of patient that's affected with cementosis dysplasia. Of course, we know that, and it's. I'm sorry, this is very my mistake. This is my mistake. I wasn't showing the display. So we have if you were missing, we have the fibroma, pseudomatoid, trabecular, juvenile, cementoosseous, ossifying fibroma. So you see the trabecular case. This one affects the male more than females. Maxillary predominantly. Oh, this one is different. This one affecting males more. Specifying fibroma, juvenile, and affecting the mandibular more than maxillary. Okay. Something different. It's okay to change sometimes. Pseudomastoid, concrescent, concentric, lamellar, spherical, trabecular, woven. Also surgical excision, just we have same as we have talking about. Ossifying fibroma without juvenile. Excision, let's see the monotrabecular. Treatment of choice, recurrent is rare. Less than 50%, no malignant changes have been observed. Okay. Still features. Of course, ossifying fibroma of the mandible, premolar isocostum, unlike the others. They were maxillar, they were mandibular anterior, mandibular posterior. It does not require removal. The fluoride, I guess, it requires removal. Fluorescematosis dysplasia, radiographic. Focal semitosis dysplasia. Non-officers treatments. Treatment. Small lesions do not require incision. Yeah. If it's small, does not require it. If it's large, it requires. These are all part of cementoosseous, or actually the Bright syndrome. Part of Albright syndrome. Okay. Cementosis dysplasia do not require treatment. There's treatment for loss of ossifying trauma, surgical removal most of the time. Recurrence is rare, but with juvenile is have a high recurrence rate. Albright syndrome could be removed. Now, after we finished, we can play any game like Slither, Slither.io, and I hope it does not have any problems within it, because if it could have problem, then we will not be able to play it normally. And that's why I hope it will be played regularly. As we can see, we are the snake. And these kinds of game that will bring us more more viewers, because the other types of video like stuff did not bring us any kind of views. Only this type that is only chance to bring views is to play games. And that's what I'm doing, and you have to be good at the games that you're playing. Unless, of course, the internet is very good, the game will not be playable. Ping is high, and I will not be able to acquire and require that much of points in such games. Let's go ahead and search for another game. Of course, anyone can leave a suggestion below on the live chats. Leave your comments and they will play the game with you, unless it's a game that requires a high internet speed. For that, I don't have the necessary tools to provide you with such games. That's why we will be obligated to show different kinds of games. I was thinking about chess. Let's go ahead and play chess. We might get some views from smart people. Who knows? We are now playing with the computer. We hopefully will defeat him easily. His name is in game. I don't know his name exactly, but he's a very good actor. He's a very good player indeed. And now I will try to make sure that I do not lose this game. I'm not a professional player, but I know some tricks. I know some tricks that could defeat such adversary player. And this player, I will try to kill him immediately. As you can see, he cannot even play properly. I think he is in a very big problem. Don't know what he's gonna be doing, but he won't be able to kill me using normal tactics. I am moving my horse to surround his castle now, and later I will be advancing through his castle and might even get a chance of killing him, surrounding him, making sure that he will never kill my stuff. Let's see what his move will be. I lost my, of course, my soldier, unfortunately. But I will not surrender for such tactics, as these tactics will not play good with me. I know this game very well, and I know how to defeat the enemy. Let us see what his move will be. He's thinking now. Now this wasn't a bad move, but I can easily get rid of his move and destroy his things. Now he's trying to kill me, but he will never succeed in such poor tactics. I will advance through his castle and destroy his I will destroy his adversary template. Now I will use my energy to wait and see what it is will be doing, and now I will go in front of him so he will be unable to do anything. And later I will advance and try to kill his forces and horse. Looks like he is surrounding me, but he cannot do anything, don't worry. I am the one who is in control of this game. Watch as I will defeat such enemy in my cool tactics. Look at me as I am advancing my king. It's a smart move requiring lots of brain cells to be performed on such adversary guy. These tactics are not used usually in games, but I know how to play with the enemy's mind and make him surrender under constant pressure. There we go. Now look what's happening. Look what am I gonna do? Now it looks like he is surrounding me, but never at all, not even in a million years. I will go back. I'll bring my leader back and let him kill my elephant. That's okay. I will give him this chance. And I know he cannot do anything about it. Now I will move and face his king directly, and I will defeat the king. as we can see now. It is not a bad move. I will show him who is the leader of this game right away. I know my position is a little hard now, but don't worry. I will show him how to play with such an amazing master like me. I know all tactics of this game. I still have some soldiers, but I can make them go and fight the leader. Don't worry. And I will kill him as he gives me this chance. Now I will move and surround his adversary kings. Don't worry, we will win this game. Hopefully, maybe. We will try to win this game just as normally as we can do it right away. You will watch and see how of an easy fight it will be. There we go. We will make him suffer before he dies because we have mercy. And we killed his soldier. This is an act of revenge. I think the proper choice now is to end this match, as we cannot do anything. But we will try to make our soldier promote to become a prime minister. Therefore, we will try to destroy his army. As you'll see, that's what I'm going to be doing. Looks like that I'm surrounded by the enemy, but I can come back. This time we lost, but maybe the next time we will win. That's okay. And this game was nice, and we played and we enjoyed this game. we will send any status and message. Yeah, thank you for listening, and we hope you enjoyed such amazing game of chess. For today it was a very nice day. We played, we won sometimes, we lost sometimes, but we tried our best. And excuse me, as this game was not presented on the screen, that's why we will bring it to be presented on screen. Right now. We will bring this game on the screen to present it on a different type of screen. Unfortunately, this game was not on the live stream. That's why we will make the game. We will play another game this time, but this time we will play it properly and we will make you see the game at the same time. We will not get outside of this game outside of this what do you call it, view, or some people call it I don't know, the game of chess or the game of over the stream. We will not get out of the stream before